Like, for instance, like if you were somewhere in like a European country and woman has a baby, automatic 6 weeks of pelvic health therapy from a therapist, which is awesome. Us being in the United States, we're a little bit behind the times. So a lot of people have to do their own research and seek us out.
What are some symptoms or impairments that women may think are normal, but are not normal, where they should seek out somebody like you?
This is the part where I talk about how I get really, really mad and upset at the Depends commercials, because you don't have to live like that. Do your research into specifically physical therapy and seeing what's close to you. Check out like reviews of different places. So you really want to, and you want to do that with any type of healthcare professional, and use physical therapy, because I mean, surgery is necessary if you need it, but there's also different ways to kind of like prolong that if it happens.
All right, guys, welcome to Becoming a Better You podcast. Today we have Doctor of Physical Therapy, McKenzie Talbot. So we're going to talk all things about physical therapy and especially women's health and maybe some other fun stuff as well. So McKenzie, welcome.
Hi, welcome. Thank you for having me on your podcast.
Did you just welcome me to my own podcast?
Yes, I did.
You're the friendliest guest I've had. Okay, so let's get right into it. So you're a physical therapist.
Yes.
Can you tell us where you went to PT school and why you chose to be a physical therapist?
I went to PT school, University of Rhode Island. I graduated in 2012. Reason why I got into physical therapy, I came from a family of medical professionals. Thought I wanted to be a pharmacist for a really long time. Realized that I hate chemistry, so that wasn't really gonna work. But no, in all honesty, I was an athlete all through high school. I was a soccer player, I was a figure skater for 17 years, and a competitive ski racer, both alpine and cross country. And what really catapulted me into going in physical therapy, I was going in that direction anyway, but I ended up really busting up my ankle during a soccer practice and had a really crappy PT. So,
shout out.
Ankle's definitely not the same. So, yeah.
And I think that's common for a lot of people where they had physical therapy in the past. But I think a lot of times it's they had a good physical therapist and they love what they did, right? That's usually what I hear, not usually that they had a bad PT. Mm-hmm. So then did you take that experience and you were just like, I want to do for other people what this person couldn't do for me? Like, what was the drive there?
Definitely wanted to be like, I can totally do this better. And this is coming from a 17-year-old kid.
And you followed that dream.
Yeah, I did.
So going through grad school, so I also went to URI. So going through grad school, what did you learn from that experience? Now, for you, it was a little different than me because you came from another state.
Right.
And so you were alone, where I had a whole support system and a studio already in place, you know? Mm-hmm. So those 3 years, what did you learn? You know, how was it being on your own?
Well, I mean, yeah. So I did my undergrad at the University of New England in Bedford, Maine.
Maine, okay.
Yep. So awesome DO school. And I was accepted in their DPT program, but then I got accepted into URIs. So I said, you know what? I don't know anyone. So let me pack up my car and just move to a completely different state.
Did you just want like a fresh start?
Yeah. I wanted to change.
Or did you know I was there and you were like, I got to go?
Yeah, you wish. Yeah. No, but actually one of my friends that I went to UNE with, she and I actually went to URI together, both for physical therapy. Shout out to Dr. Danny Parent.
That's your best friend.
Yes.
So then, what was the biggest life lesson you learned from going through grad school?
A lot of blood, a lot of sweat, a lot of tears going through grad school. But, what I liked about the program was their smaller class sizes. So everyone really got to know each other. So that's how I got my support system, was through all these other people and our professors. And just, I felt like, having that type of closeness and that like small scale, I had a better education, better learning experience. And, being in a small state too, able to make more connections and things. So what my program did, because my whole setup was a little different than yours.
Right.
So every semester we would have these things called, we call them ICEs. It's integrative clinical experience. So you would have 3 hours once a week per semester, either an outpatient location or an inpatient location.
So outpatient being like a business, private-owned business, inpatient being like a hospital or nursing home.
Yes, yes. So the reason why they wanted us to do that is because, our first 2 years of grad school, spring, summer, and fall was all academic. And then our final year was all of our 3 big clinical rotations. So they had us do those little ICEs to get us familiar so we didn't look like deer in headlights going on these clinicals.
I definitely know that.
So, yeah.
And so the big learning experience for you was that you, especially for you being alone, as long as you stay consistent and you persevere through the ups and downs of challenges, you come out the other end and now you're this evolved person.
Yes.
Would that be?
Yeah. I kind of really didn't have a choice. It was either sink or swim.
Right. So. And sometimes that's what makes us.
Mm-hmm.
Right. Because if we don't have challenges in life, then we can't evolve from the contrast. All right. So now you're a physical therapist, but you specialized, right?
I have some specialty training. Yes.
So when we talk about what's the difference between like a physical therapist like me, who's more general, even though I did more chronic pain patients, but you're a women's health physical therapist. So why are women health physical therapists important? And do people even know that you exist?
We're becoming more mainstream, but it's really surprising. Other healthcare professionals and even the public in general have no idea what pelvic health PT is. Which it kind of sucks. Like, for instance, like if you were somewhere like a European country and woman has a baby, automatic 6 weeks of pelvic health therapy from a therapist for rehab and recovery, which is awesome. Us being in the United States, we're a little bit behind the times. So a lot of people have to do their own research and seek us out and have to call and see us.
Be their own advocate.
Yes.
And most people probably don't do that.
No. But some other healthcare professionals as well are getting more used to like what we do.
So what do you do?
So what do I do?
Yeah, what do you do as a women's health therapist?
We treat all types of situations, urinary incontinence, pre-baby, during pregnancy, and postpartum as well. Because, your pelvic floor is just like a muscle group, like any other muscle group. So if I tore my hamstring, my doctor would send me to PT.
Right.
So, but, why not treat the pelvic floor exact same as hamstring, calf, quad injury as well? Because, when you go through that whole process, that's a lot of trauma and a lot of pressure and everything that goes through the pelvic floor, and it needs some rehab. And
that could be either from pregnancy or from an injury.
From an injury?
Right, it could be anything. And then because the pelvic floor area is so specialized, it's much better to go to somebody who's trained in it versus just a regular PT like myself.
Right.
Right? So then what would you do, right? So someone comes to see you. We don't care the mechanism of injury. They have these impairments. The pelvic floor needs to be rehabbed. What does it look like for you versus if I were to treat it, right? I give them Kegels, right? I don't know if I said that right.
Yeah.
But what do you do?
Well, Kegels would not be my first choice.
There you go.
So how I treat, because I have other training in different areas as well from a holistic standpoint. I treat all of my patients as a whole body perspective. So you're not just like a pelvic floor. You're not just a back. You're not just a neck. You're a whole person. So what I do with every single one of my patients, whether it's a pelvic health patient or just a regular patient, is I always start with looking at the pelvis and pelvic alignment, because our pelvis is our body's foundation. That's where our center of gravity lies. So if you have any type of dysfunction in it, it can cause issues down the connect chain into the legs and the feet, and even up into the spine, neck, head, and jaw. So what I do is I start there and kind of work externally first with, bigger muscle groups to see what kind of dysfunctions are there. Because with pelvic health, there's also an internal component to it.
Which I'm never doing.
Yes.
Right.
So, you want to most important thing when treating pelvic floor, and as well treating any type of patient, is you want to, really establish your patient rapport and make them feel comfortable. And that's really, really detrimental in pelvic health world because it's very vulnerable. You don't know people's situations. And, when we're doing this type of work, certain things come up physically, emotionally. And so we have to really be very mindful about that as well.
Yeah, because when we talk about like internal therapy, like you're going inside the person.
Yes.
Right. So that's why this is so specialized because like you're doing more than just, okay, do these exercises. You're doing what we would call manual work in the physical therapy space. So what are some symptoms or impairments that women may think are normal, but are not normal, where they should seek out somebody like you?
So this is the part where I talk about how I get really, really mad and upset at the Depends commercials because you don't have to live like that. We're seeing it more like in, my age demographic where people are starting to have like, first babies and things like that, that are being more advocating of themselves to go with pelvic health therapy because, in the baby boomer generation, women have been told that, oh, well, yeah, it's fine to have urinary incontinence. Like, so here, wear this pad and just like live with it. Or, they've heard from their healthcare professionals that, oh, well, you have incontinence, you have pelvic organ prolapse because you've had like 3 kids. And like, that's pretty much, there's nothing else I can do for you. Well, there is, you can come see us.
Right.
So.
And so things like, in my genre now, like having to pee when you jump, right?
Yeah, that's not fun.
But that can be helped by someone like you. That's not something that has to happen.
Right.
Or we talk about when the abdomen rips apart, right?
Yep, the diastasis.
Right. So they can come see somebody like you. Right. So then what does so say we had this just a normal patient coming to you, and then what is a treatment program? What should they expect when they come to see you? You do the eval.
Right.
But there's some treatment involved.
Right.
What would be kind of like a sample treatment plan just for somebody who's with a women's health therapist versus like just a normal therapist? What does that treatment look like?
Like I said, I'm always going to start with an assessment of checking your pelvis, and we'll work on the fascial restrictions from there, and then go into an internal treatment. And like I say with all my patients is when I'm doing internal treatment, I'm like, I am a chatty Cathy. I'm going to talk to you the entire time that I'm doing this.
What makes you feel comfortable.
Right. And I'm going to tell you everything that I'm doing as I'm doing it. And if anything's too much, you just let me know, back off, totally balls in your court. So I like to do a lot of my manual stuff first because... And I focus on that. Like where I'm working now, we have exercise specialists that are awesome that, they'll guide their patient, all of our patients through like their exercise program. Whereas I can do all the...
Which you set for them.
Which I set, yes. But I can do all like the hands-on stuff because, if you're coming to see me, like you want the hands-on, the things that you can't do at home. Yeah. So, I do a lot of that, a lot of education too, because you said like Kegels, everyone's like, oh, that's like the first thing to do. No. Mm-mm.
So I can't just give them 45 minutes of Kegels and call it a day?
No. Okay. We wouldn't want to do that. But we want to, do that education of teaching them like pelvic corrections for like an SI joint issue, working on, even basic like posterior pelvic tilts, just to find like your abs, like engage them, like they're there, they're hiding. And a lot of people don't know how to do that. So we do a lot of basic stuff like that. Like we don't want you, like walking's great, biking's great. We don't want you to like go out, run, jump, do all this crazy stuff when you have all these dysfunctions. So when we tell you you have to walk before you can run, that's like literally what we're telling you to do.
So you're building them back up, basically like ground level, right? Now, when someone comes to you, like how long have they been living like this usually?
You would be surprised. Years, right? Yeah.
And what does that do to their quality of life? They're embarrassed, like, right? Like
there's, like I said, it's a whole vulnerable like situation. Anxiety, like depression, like activities of daily living. And I'm going to say it, for women, like using a tampon, having sex, those are activities of like functional daily living. They shouldn't be uncomfortable.
They shouldn't be painful.
No, not at all.
And so do you have just a story where any patient kind of saw you, where they were, and then the transformation they had when you were done with them as the physical therapist? Do you have one in particular?
I do have one, and she stands out very, very vividly in my mind. She's a little bit younger than me. She had heard about pelvic health through a friend. And so
Not even the doctor.
Not even the doctor, through a friend who went through the whole process. And she had told me, she's like, I'm not going to lie to you, Dr. McKenzie, like, I'm really nervous about like how this whole thing's going to go. Like, I kind of knew about it, but I'm like, now stepping into the situation, I'm like, don't worry about it. We'll get through it together, all the stuff. And once again, talked to her like through her whole examination. And, she was having issues with intimacy and, using feminine products. And we had treated for a few sessions, and she actually reached out to me and sought me out. And she was like, I have to tell you. She's like, I was able to do X, Y, and Z without any issue. And I was like, that is awesome.
As a therapist, we live for that.
Oh, yeah.
Right? Like that's the feedback that we really love. I think when you go to become a physical therapist, you really have to care about people. What people might not know about physical therapists is we spend the most time out of any really medical professionals with a patient.
Longer than 68 seconds?
Yeah, like, you know what I'm saying? So we're with them sometimes 3 times a week. Could be an hour each time, 3 hours a week for weeks or months. Like, so we get to know these patients a lot more than other medical professionals. I don't know if people know that about physical therapists, but that's one of the cool things about what we do. So let's switch gears for a second, because I think this is one of the most neglected parts of rehab. And when I was a full-time therapist, I definitely had good results using this. But let's talk about fascia.
Okay.
And then like what it is, and then what happens. Let's talk about what it is first. So fascia, what is fascia? Because even in PT school, unless I was asleep for that part, they didn't talk much about it. Right?
No, because mostly when they talk about fascia, we've always been taught that it's like packing peanuts in the human body. Well, it's not. So fascia is its own. Everyone thinks like the skin is the body's largest organ. It's not. It's actually fascia. Like the skeletal system is crystallized fascia. Like our fascia wraps around all of our muscles, vessels, nerves, everything, and it attaches everything from head to toe. So
it's all inside us.
All inside us. You kind of think of it as like a spider web. So, with any type of restriction that we have, you can kind of think if you have like a pull in a sweater, what do you want to do? You want to like pull at the sweater, then all the sweater threads are going to go into that direction of that restriction. The fascia does the exact same thing.
And so I think the way I was best understand it is like the orange, like the white stuff around the orange.
Yep, the pith. Yep.
What's it called?
The pith.
Exactly. The pith. So that's the covering. So it covers everything.
Everything.
So when we have tight fascia, which covers everything, it's like me. I'm Italian. I wear really tight shirts. I can't raise my arm, the whole way. Same thing, right? Because it's restricting. So can you tell us about what happens when fascia, how does it become unhealthy?
Well, our fascial system, and this is where I was taught by John F. Barnes, who established like the myofascial approach.
He's basically the PT guru of myofascial, right?
Yes, absolutely. That, I mean, the man's amazing. He's in his 80s and he's still teaching like seminars all over the country.
That's a great beard.
Oh, yeah. He does. And a sweet ponytail. Yep.
What about that?
So what he always taught us is, the fascial system is made up of like all these like microtubules, and we have like fluid that goes into it. So over time, we call the fluid the ground substance. So over time, that ground substance gets hardened and solidified, and that makes it difficult for nutrition and everything to get into the cells, and even toxins and stuff to get out of the cells. And also with, studies that they've shown, anytime you have a fascial restriction, that's the equivalent of 2,000 pounds per square inch of pressure on pain-sensitive structures. So that's a lot.
So it's really constricting what's going on.
Right.
And so a couple questions with this. I would say most medical professionals don't treat it. Is that a fair statement?
Well, they think that they do, but some do, but a majority don't.
And then the ones that think they do, maybe they don't.
Right.
Okay. So when we have restrictions, like even for me, and this might be wrong, but this is why I'm asking you because you're the expert in this. So from my understanding of fascial releases. Like the therapist can do manual stretches and stuff like that. We can also stretch on our own. But it takes about 90 seconds or more for the fascia to actually start stretching. So when we stretch for 30 seconds or even a minute, it's not enough time for the fascia to start stretching. So yeah, you could be stretching the muscle, but if the fascia is too tight, we didn't hold it long enough. Is that right or wrong?
Yes. So when we're working on these fascial restrictions, we want to go into what John calls like the restriction barrier. And it's anywhere that feels like hot, hard, or tender on a patient. And once we get to that barrier, we hold it. And we want to hold it for a minimum of like 5 minutes. And that seems like crazy, but
insurance pay for that?
but it's very effective. So it's different from massage. So we don't want to do anything that we don't ever work with lotion because we don't want to like glide over the skin. So we actually want to make the difference at the deeper fascial cellular level. And so John actually gives a really good analogy on when you feel like that fascia softening, it almost feels like, like you visualize like butter melting or like taffy stretching. And it's very subtle. But for instance, if I'm working on like, say your psoas muscle deep in your abdomen,
hip flexor,
yep. Because the fascial system is a whole wide body system. I mean, I might be working here, but you might feel it somewhere else.
So, and this is, I remember patients would be like, I have back pain, but like, or leg pain or whatever, but like, it's like I flex my neck and then I feel it down here, right? Because the whole system's connected, which I don't think people understand. Like, oh, I understand. Right? Because the fascia is all over it, the whole place.
Right.
So even in therapy, like when I would do it, you could almost feel the release.
Right.
Like if you're pulling on the arm or whatever, like,
it's like that telescoping motion.
Yeah. Like you, how important is that to rehab? Right. Like, so I saw a lot of chronic pain patients. So for me, it drew me to a little bit of John Barnes. It drew me to, I think it's Travell and Simons, but forgive me if I'm wrong, but like the trigger points.
Yep.
And releasing trigger points, which it's the same thing. In the muscle, you can have like your muscle here, but there's trigger points in parts of the muscle. Now what happens is because those get so tight, you can't get blood in there. Blood is need to get in there to bring the nutrients and get out the waste.
Right.
So you have all these little trigger points in the muscle.
The fascial restrictions, yeah.
Now you have keep defining it for me. So now you get this muscle, but it has all these points, and now it constricts the muscle, right? Because you have all these points where blood can't get in, stuff like that. And that's where most of my patients saw the most relief from a deeper tissue massage and some myofascial relief techniques. How important is that in rehabbing a patient who has a chronic injury or who hasn't been active or who is an athlete? How important is all that stuff?
It's very important. And one of the key take-homes that we learn in this type of work that we do is you have to feel in order to heal. And this is where John talks about what we call the healing crisis. And it's different for everyone. It has an emotional concept to it and also has a physical. And it can range anywhere from like, oh, like I'm a little sore from like workout pain to like, I just got dropped out of an airplane and went through the washer and dryer twice and then got hit by a bus. And, in our society, we're taught to not feel like pain. Like, oh, you're having pain. Like, here's like a bunch of medication for you to take. So when I'm doing this work with people, I'm like, make sure you're drinking a lot of water and being hydrated because, we've released the restrictions. We want to get the hydration into the area that it's been so like gunked up for so long. But
is gunked up a technical term?
Yes, it is.
Okay.
It's a medical term. Look it up. But what we also want to do is, educate the patients that, okay, you might feel this soreness and I don't want you to freak out. I didn't do any damage or anything. That's just your body's response to it. So that's all part of the process. And I feel like if I tell someone that has like chronic pain or an athlete, all that stuff, once I do like that educational component to them, they're like, oh, okay. Yeah, that makes sense.
Because they're looking for you as the expert to guide them, right? I think that's extremely important. But you bring up a great point, which I actually haven't thought about in a while. It's the fact that in society today, everything is like you have pain medication, but pain is just an indicator that something is wrong, right? So like
something needs to change.
And something needs to change. So, and that could be emotional pain or physical pain,
right?
Because we're sitting home and you're pained with your life not being where it is. That's an indicator that we need to take the bounce and make a change.
Right.
The other thing is with your body. So if we didn't have pain, then we wouldn't know that we need to make changes in our diet or our exercise, right? If we didn't have the reception of the nerves, then you could put your hand on the stove and you'd be like, this is all right, whatever. But you'd be like, what's that smell? Right? And then you wouldn't take it away. So pain's an indicator that something has to change. It's your body needs the pain.
Right.
But if you're medicated, you don't get that feedback.
No.
And now you don't take the necessary steps to
make the necessary changes
exactly
in order for you to progress where you need to be.
You know, I often say from jiu-jitsu that, like, you know, I wake up stiff like every day, just getting thrown on. We would get thrown on cement, whatever, as a kid too, right? And you learn how to fall. Oh,
I know. I've been thrown around on the bags a few times.
Willingly. So, because McKenzie also trained jiu-jitsu. So, with that being said, like, so I'm stiff like every morning, but in my head, I've already been like, okay, cool. I actually kind of enjoy being sore in the morning because it forces me to go to the gym.
Right.
All right. It forces me to do that physical activity to keep myself healthy, to keep my head on straight. So I kind of look at it. It's how you're looking at this pain. But if I mask that and just took medication, I'm reliant on the medication. Mm-hmm. And if I'm not getting if I'm avoiding motion and exercise, my body's not healing.
Right. And movement is medicine. That's what is drilled into us from day one of PT school. And I'm not saying that medication isn't necessary. It's absolutely necessary if, you know, warranted based on the situation. But I feel like, you know, a lot of people, when they do have like this pain and everything, like they're just given like a bunch of meds, like you said, to mask it. And then they're like, oh, well, I guess I feel better. Now I don't have to do anything. And then that's when they kind of fall into like that sedentary category. So.
And then we put the weight on.
Yep.
And then
your joints suffer.
People become kinesiophobic, which means they don't want to move.
Mm-hmm.
And even as a fitness instructor up here, you know, because I get a lot of people who are in therapy, right? Because they seek me out,
mm-hmm.
and I'd be like, "You're good, just move down, you're fine," and they do it, and then 2 weeks later, they're like, "Oh." Right? Because mm-hmm. I'm just giving them the okay that, listen, you're not going to break in half, right? No. Do what you can, and each day do a little bit more. And sometimes they need a guide like you to really let them know what to expect and then be there for them, which is why rapport is so important.
Right.
Right? So let's talk about, there's other approaches to women's health besides like the MFR, right? The myofascial release.
Mm-hmm.
What would be some other like treatments besides like what you do, right? Because there's other specialties. Women's health is a vast sphere, right? There's many ways you can approach it.
Mm-hmm.
You do it one way.
Mm-hmm.
What could be another way to this?
Another way is, you know, people utilize like biofeedback, and that's with like electrode sensors that like it's attached to a monitor, it's attached to the patient. And the patient will actually see what it feels like to contract the pelvic floor muscles. They'll see it on the monitor and be like, okay, this is muscle group. This is how I know how to use them. Because 9 times out of 10, like people don't know how to use that specific area because, you know, they've never been taught or they use Dr. Google. And
yes, of course.
And yeah, it's kind of all over the place. Like I said, I don't necessarily like use that type of stuff because I like to do like my manual stuff and like, you know, teach patients how to do like self-treatment at home and things like that. And that's all part of their home exercise program. But yeah, so with women's health, I, you know, tell people, I'm like, don't freak out. It's kind of like going to the OBGYN, but we're just a little bit nicer.
And so let's talk about how important it is for patients to do their home exercises.
You can lead a horse to water, but you can't force it to drink.
Right.
So what we have to do as physical therapists is like 98% of the time, it's us teaching ways for you to help yourself because, you know, I'm going to treat you for X amount of weeks, X amount of months, but I also want to teach you how to do this stuff at home because I love you. You can come in and say hi to me anytime you want, but, you know, I'd rather treat you for, you know, 3 months than like 3 consecutive years if you're not going to do it on your own.
Yeah. And you're trying to make yourself progressively unnecessary,
mm-hmm.
right? So if they can take what you give them, they can continue with it, but then they need like a checkup with you to like see what else is going on or whatever. That's where physical therapy would be amazing.
Right.
Right. But you've had pain for say 20 years, they see you twice a week, let's just say 45 minutes.
Mm-hmm.
Well, there's 24 hours in a day. So if you're not doing anything else, McKenzie's awesome, but like they're not going to get the results they want.
Mm-hmm.
Right. And that happens a lot in PT,
right,
from my perspective.
And so that's why it's so important for us to like have you do your exercises. Like when you come to see me and I'm doing an assessment, I'm going to give you homework. I'm not going to give you 50 different exercises because I know you're not going to do all of them. I'm going to maybe give you like 2. Be like, all right, we're going to go through this together and we're going to make sure that you know how to do it, that I know that you know how to do it. And, you know, I just tell people at the end of the day, I'm like, you know, I kind of have to give you a little bit of tough love because when you're coming to see me, like, it's not my pelvic floor that's in dysfunction. It's not my knee that's bothering me. It's yours. So you have to take initiative in your own rehab after you see me. I mean, don't get me wrong. I love all my patients, but, you know, you have to have them.
Well, people have to help themselves, right?
Yeah.
I tell people now when I meet with them, like, listen, if they want to lose weight or jujitsu, like, I can't want this for you more than you want this for yourself.
Right.
I'm good. I'm really good. Mm-hmm. But if you don't have the desire to do this,
then what are we doing?
And it's not going to be a good experience because as the coach or the therapist or whatever, the instructor, like, I'm trying to help you. But if you listen, you don't even have to give 100%. Just give me 50% and I'll get you there. But like it's a two-way street, right? People really need to be their own locus of control and take control of their lives. Just like you were saying, we were alluding to like pain and like understanding what that pain is. It's feedback your body's trying to tell you because your body can't talk to you like that. That's how it talks.
Right.
You need to do something here, right? This isn't normal. So there are women out there who are embarrassed, afraid to seek help, maybe don't even know that you exist as a woman's health. Right. So what do you want to say to them? What can they do? What should they do?
Well, another really interesting fact when it comes into the women's pelvic health is, you know, women like, oh, I just had a baby, or like whether it's natural or it was a C-section. So, you know, I have a patient coming to me that has a C-section scar and she's like, oh yeah, by the way, like I also have this back pain. And I was like, ding, ding. People don't realize that a C-section scar, so scar tissue is great, you know, when we need it, but it doesn't necessarily stay in one position. So you can kind of think of it as like a spider web. So untreated C-section scars, those adhesions are a huge contributing factor to back pain. And not a lot of people know that.
I'm taking a guess here. Would the reason be that through the fascia on the skin, it constricts it, so it becomes too tight? Too tight,
and also when you're basically cutting through like 7 different layers.
Well, that
tissue.
Also, yes,
so,
yes.
You know, there's that.
You're losing the core stability.
Right.
That's interesting. I didn't know that. That's why I don't specialize in this. So somebody's watching this, right? Either they're in need of a women's health physical therapist, or they just need to move more. You, as an athlete, as a physical therapist, what do you want to tell them? What should they do?
I would immediately, you know, do your research into specifically physical therapy and seeing what, you know, what's close to you. Check out like reviews of different places. So, you know, you really want to, and you want to do that with any type of healthcare professional. But I definitely, you know, advocate and use physical therapy because, I mean, surgery is necessary if you need it, but there's also different ways to kind of like prolong that if it happens.
A physical therapist who's really good can save you from surgery.
Right.
Right? Like, so you should always seek out a therapist first, in my opinion, just to give you their opinion on what needs to be done or what you can do. There's been multiple patients I've had that I've saved them from surgery.
Yep.
Just by like arranging them out, like massaging them, fixing their posture, which is huge.
Yeah. Especially people that have desk jobs.
Sure.
Yeah.
And because you don't ever want to get cut open. Like that's the last thing you want to put that off as long as you can.
Right. So physical therapy is the most conservative form of like healthcare before you have to go down those avenues of like extreme stuff like surgery.
Now I had Garino Bani on here, another physical therapist, and we talked about, do you think that people should be able to come to a physical therapist whenever they want, especially like, you know how we go to the dentist a couple times a year? Mm-hmm. If you don't floss, you go more like myself. But Do you believe people should see a physical therapist twice a year, like you would a dentist, to check the alignment, to check your posture, so you can be like, hey, Marc, fix this. You know, if you keep this up, this is why your shoulder's not moving. Stuff like that.
That's what we call tune-ups.
Yeah. But the way the medical system is now, that doesn't happen like that.
No, it doesn't. I mean, we are in Rhode Island, we are a direct access state, so you don't necessarily need a physician referral to come see a physical therapist, which is nice. I don't know if a lot of people know that as well. But yeah, no, it doesn't work like that, where you can just like come in and get just a little tune-up. I wish.
I think that people will be better off for it.
Mm-hmm.
Okay, so tell the people like where you work now, how they can find you. What's the best way if they wanted to see you for an appointment? How do they do all that stuff?
Well, I work for Performance Physical Therapy. I am currently at the Warwick location on Centerville Road, and you can do a Google search. Our website's great. It shows all of our different locations. I believe we have, I want to say, around 22 different offices throughout Rhode Island and Massachusetts. So if you are looking for me, I work with a great group of ladies that all specialize in pelvic health, and you can just give us a call, and we'd love to take you.
Now, before we end this podcast, I'd be remiss if I didn't allow you to show your custom heels to the...
oh, God.
Like, because they might not know this about you, but like you, self-proclaimed nerd?
Very self-proclaimed, very
Self-proclaimed.
much nerd.
So can you show them? Like, can you show them? These are... Tell me the story behind these.
Okay. I don't know if y'all can see these, but...
I'll have to do a zoom in on the editing over here.
Yeah, okay. So I...
nice flexibility, by the way.
Thank you very much.
No problem.
I know a thing or two about some flexibility.
I've heard.
So funny story. Yes, being a self-proclaimed nerd, I also do have a Star Wars droid decal on the back of my vehicle, and I wear it proudly. So with these high heels, I came across these on a guy on TikTok that is an artist over in the UK, and he does custom design shoes. And the video that I saw him making, he was making Jurassic Park shoes. And I'm like, those are so cool. I totally want a pair of those. And they're all custom made. He hand draws them, paints them, like seals everything. It took 14 weeks. So I emailed him and I said, I really want a pair of the Jurassic Park high heels. But could you do me a solid? Have you ever done Star Wars high heels before? He goes, no. And I'm like, what? Star Wars has been around since 1977. Come on, what do you mean you haven't done a pair of these now? Because it's such like a cult following. So he's like, send me a bunch of pictures and custom design for you. And he's like, just, give me a few months and we'll get them done. And then they just came on my doorstep last week. And
just in time for the podcast.
Just in time for the podcast. Yes. Specifically said, James, I need these right in time for the podcast. So he actually featured me and tagged me in his video of him actually painting and making my high heel shoes that are great.
And both sets are amazing. They're high quality.
Yeah, they're awesome.
So not only do you...
And very comfortable.
Not only do you know physical therapy, you know style.
Yes.
Well, McKenzie,
yes.
it's been a pleasure. Performance PT is where you're at. They can call, they can request you as a therapist.
Yes, absolutely.
Even if it's not women's health, they can also request you as a therapist.
Yes.
As well, just for, general pain or whatever. But thank you. We had a great time.
Thank you.
Hey guys, Dr. Marc here. Now I know a lot of you want to know how we get all these amazing results with our clients, and it comes down to 3 things. The first is fun fitness classes that burn a lot of calories. 2 is giving you an accountability coach to make sure you stay on track and get the best results. And 3 is the nutrition. Included in the nutrition is our food supplement. So we pair with Prestige Labs because I feel they're the best, they have integrity, and they get great results. These are actually the supplements that I take as well. Here's the awesome part. By clicking the link below, you can save 40% off the retail price. So you need that link to actually save 40%. If you just go to the normal site without my link, you're paying full price. Okay? So these are the supplements my clients use. If you are interested, definitely click the link below and it'll tell you all about them.